Hi, I'm Beth. I'm one of the inpatient physical therapists here at Boston Children's Hospital. And this is Maddie. She's one of our PT students that's going to help us out today. So today we're going to be talking about different ways to do pressure redistribution in the seated position. But first of all, I wanted to go over how important it is to do pressure relief techniques when a patient is sitting up. We all know that in bed that a patient needs to be repositioned every 2 hours, but because when you're sitting you're putting a lot more pressure on your sacrum, your coccyx, and your ischium, this needs to happen more frequently. So the standard is that we have to do some kind of pressure relief every 30 minutes. The gold standard is also that these pressure relief techniques need to last between 1 to 2 minutes. The gold standard is actually 1 minute and 51 seconds. So today we're going to go over a few scenarios on how to best perform pressure relief with a variety of patients, and we're also going to go over how important good posture is when a patient is sitting up in a chair. So since Maddie is a patient that can help with her own mobility, I'm going to show you a few ways that she can help to perform pressure release while she's sitting. The first example is just having your patient stand up. So Maddie, can you just stand on up? And then she's going to stay up for 2 minutes. And then Maddie, you can sit back down. The second way is to do lateral weight shifts. So that means offloading one area of your bottom at a time. So in doing this, the patient will lean all the way over to one side and then can help by lifting their leg and then offloading one side at a time. So Maddie, can you try to do that? You'll lean over, lift your leg. Good, and that way her right bottom is being relieved. She has to maintain it for 2 minutes again. And then you can relax, and then since we did one side, we have to do the other side, so then she's going to do the same thing on the other side. So Maddie, come lean over, and then maintain it for 1 to 2 minutes, and then come down back. So now we're going to go over an option to do pressure relief with a patient that needs a lot more assistance to move. But still in sitting. So we're going to use the cardiac chair to our advantage. The way that we're going to do this is we're going to recline the cardiac chair all the way back. Then we're going to use the chuck pad to turn the patient over to the side, and then we can stick a pillow in to offload the area that we want to on one side. We're going to have to maintain this for 2 minutes, and then we can repeat on the other side to fully offload the surface that we want to. So Dennis is hopping in to help demonstrate this. So he's going to recline the cardiac chair all the way back, and then he's going to use the chuck pad to roll the patient over to her side, and then he's going to stick the pillow in right where the bottom is and then bring her back. And then we can leave her here for 2 minutes if she's safe to do so. After our 2 minutes, we can remove the pillow, and then we can repeat the same thing on the other side. So Maddie's been identified as a patient that's at a high risk for a pressure injury. If you have a patient that's been identified as a high risk patient, make sure that you have the team put in a PT order to help you identify the best wheelchair cushion or seated device to help optimize pressure relief when they're out of bed. So here we are with Maddie. We're using a tilt and space wheelchair with her because you can use the chair to fully offload her pressure injury surfaces like her sacrum, her coccyx, and her ischium by using the chair itself. So the way that we can do this is that we can fully tilt the wheelchair back and maintain it for 2 minutes easily while keeping our patient safe. And we would want to do this every 30 minutes while she's sitting in the chair. The other features of the chair that can optimize posture in a patient that can't really reposition themselves by themselves is like using laterals, armrests, and footrests that we can adjust to best accommodate the patient and their needs.